Hello, my name is LFinucane, and I will be sharing my expertise on what I learned from the journal Quality of Life with Relugolix Combination Therapy for Uterine Fibroids, a Liberty randomized trial. Uterine fibroids are non-cancerous tumors located on the uterine wall. They are a burden and affect a woman by causing heavy menstrual bleeding, pain, usually in the lower back, bloating, anemia, and pelvic pressure. Uterine fibroids can also negatively affect the daily life of a woman, her social life, her family life, and her work life. Uterine fibroids can also lead to a woman's mental health being affected, such as depression, social isolation, feeling of helplessness, and increased anxiety. Overall, her quality of life is affected. The purpose was for the Liberty program. They wanted to evaluate the safety and effectiveness of Relugolix combination therapy on women that experience the burdens of severe symptoms of uterine fibroids and the health-related quality of life among women with uterine fibroids. The methods they used for this study was that it was phase 3 of the study, so they pulled from Liberty's 1 and 2 study. This was a double-blind study where Relugolix combination therapy had 253 people and the placebo group had 256 people. This was 24 weeks long between April 2017 and July 2019. It was a randomized trial. There was a placebo control group and they used questionnaires at the baseline, 12 weeks and 24 weeks. So basically, every 3 months, they would do a questionnaire. The interventions that were used was the Relugolix combination therapy had 40 milligrams. It also had estradiol, which was 1 milligram, and norethindrone acetate, NADA, 0.5 milligrams, and then it also was versus against the placebo group. The outcomes that were measured was the symptom severity of the fibroids, the health-related quality of life in women with uterine fibroids, the concerns they had, activities they did, energy they had, moods and control, and sexual function. As you can see from the health-related quality of life subscale scores, that the Relugolix had a significant increase to the quality of life compared to the placebo. A summary of the different groups that they used was that they were multinational. They used premenopausal women from the ages of 18 to 50 years old. They had ultrasound confirmed uterine fibroid diagnosis. There were 509 women that were enrolled. They also had subgroups where they had regions of North America versus the rest of the world. Their race was Black or African American versus not Black or African American. Ages that were less than 40 versus 40 years older, equal or older. They had a baseline menstrual blood loss volume they measured, uterine fibroid volume they measured, and the uterine volume they measured. Here we have different graphs of the subgroup analysis for In figure 6, it was the subgroup analysis for changes in the bleeding and pelvic discomfort scale, where the Relugolix median was going to the left and the placebo was moving to the right. Whereas in figure 7, the subgroup analysis for changes in the quality of life total score, the placebo is going to the left and the Relugolix is going to the right. Findings. So the women that were in the Relugolix combination therapy group found that there was a significant decrease in the severity of symptoms, their pain, their blood loss that were from the fibroids. And then there was also an increase in the activities and the moods and the sexual functions of the different women. The strength of this study was the analysis of the many improvements of the various burdens from the uterine fibroids and the health-related quality of life from the Relugolix combination therapy. Liberty also was the one to introduce the BPD scale, which is the Bleeding and Pelvic Discomfort Scale. This can be used in future studies to assess the level of discomfort women experience from the uterine fibroids. Weaknesses of the study. So the authors reported limitations of this study from being that there were multiple comparisons in such a short period of time, only 24 weeks. And there needs to be further research to explore the long-term effectiveness of Relugolix combination therapy to reduce uterine fibroid symptom burdens and improve the health-related quality of life. The author's conclusion from the positive results they had of Relugolix combination therapy on improving the uterine fibroid symptom severity and its health-related quality of life, the authors concluded Relugolix combination therapy has the potential to reduce common symptoms of uterine fibroids and to improve many aspects of a woman's daily life. My conclusion after reading through this study and others using Relugolix combination therapy for uterine fibroids, I think it is a positive therapy for women who deal with severe symptoms of uterine fibroids.